recording, so I'll do that. I did want to share, before I get to the guest speakers, I did want to share a little bit more information with you about the organization and exactly the way it works, with an overview. Can everybody see my screen right now? Welcome to Middlesex County.
Yes.
Okay, so as you know, I'm Michelle Puzo, the president and co-founder of Your Community Cares, and I am just so impressed by everybody coming out to learn more. I know that there's so many vast needs in Middlesex County, and we're hoping that we can help fill in some of these gaps that exist. So in 2019, we created the platform yourcommunitycares.org, and that's the way for people to connect with a neighbor that's in need of help, because I recognized that I was a physical therapist. I was going into patients' homes, and I was just devastated every time I would leave their house and they needed more help at home. They were either widowed or divorced, or they were alone in some capacity. And I just thought, what if they could get connected to their neighbors? And the demographic of people is growing, that 10,000 people are turning 65 every day. And if you're, most of us are in this world and we understand some of these numbers, but for people that don't understand the aging population right now, it really puts into perspective how much money you have to have saved to live longer, how much money it takes to adapt your house to be able to stay in your house. Many people want to stay home, and like caregiver homes, that's another example of keeping people at home with caregiver support. But with that, some people need that respite care, and volunteers can provide that as well. It's been amazing to watch how our technology, really using the technology for the good to help support people. And as we've grown and scaled across Connecticut over the last 3 years through COVID, it has really made us realize that we needed to create that digital equity and inclusion so that people that didn't have the internet could be involved as well. And that's where we've created partner accounts so that people can get signed up as individuals, or they can get signed up through a partner, someone that does have the internet, because we don't want anybody to be left out just because they don't have the internet. We know that will help improve mental health and physical health outcomes if they can have the same resources that other people have that do have a smartphone or a computer. So that was something that we decided to grow during the pandemic and realize that was an important piece for people that could be signed up by someone else. And here are some of the statistics that really put into perspective how the world is changing. More older people than younger people, and our idea of neighbors helping neighbors on a grassroots level to support people, I think it is ideal, because there's less people in the workforce. There are less caregivers in the workforce. So that being said, how are these people going to be taken care of if they live alone, have mobility issues, and need some additional help? And that's where the idea of volunteer support comes in. And throughout the COVID crisis, we were successful in engaging into communities, and people realized that during the time that they were maybe off from work or home, that they could give back. They could give an hour a week, they could give an hour a day, whatever they wanted to give. They're able to do that through the website. And we'll go over the website in just a few minutes. But it's just staggering, the amount of dementia patients and disabled veterans and chronic diseases. Everything is on the rise. And that means that more people are going to need more support. They do not want to be institutionalized. They're trying to stay at home where they're comfortable. And maybe their family can come from Massachusetts, once or twice a month, but maybe they need a little assistance once or twice a week. And that's where the website is set up to do that, provide those connections for people. So community members, those are the people that need help that are over the age of 70 or over the age of 18 with a permanent or temporary disability. So that means if someone came out of the hospital with a broken ankle or a broken leg or a knee replacement and they needed some help, they can sign up on the website. They can ask for help with teaching technology, pet care, play games, laundry, you name it, they can ask for it, like Sal was mentioning earlier. It's just not personal care and it's not licensed work. So they're not getting plumbing or electrical work done. All the volunteers are 100% not paid. They are free volunteer support to have unlimited support using the website. So that community member goes in, signs up, logs in every time that they need help, and a volunteer will be able to see the opportunities, and when they're available, they will accept those appointments that are most convenient for their schedule. And that's why our system's a little different than most volunteering, and that's why volunteers are really engaging in it, because it makes it convenient for their schedule. And our technology is the most secure website that we can have. It's encrypted on both sides because we are taking a social security number. In order to do the background check, we do need that social security number, and then it is X'd out once that person is approved. There are many town leaders that are getting involved to refer people that they know that are in need. You're identifying those people that are in need, whether it be the fire department that goes and does that pickup once a week for that same person that is doing things that maybe they shouldn't be doing. Anyone can refer someone that is in need of help, or you can, recommend the high school. Volunteers can be over the age of 15 to help support in their community and gain those community service hours as well. So like I mentioned, there are 3 types of accounts. There's the individual account, the partner account, which is either the community member partner. So that's anybody that wants to enroll more than one person that needs help. So in Windsor, we have one of the assisted living facilities. They enroll people that need transportation. In Vernon, again, they have a resident services coordinator that enrolls people that need help in their facility, that need help but don't have the technology. And then a volunteer partner would be that high school that wants to bring a group of volunteers to work together, or a church that wants to work together and volunteer. So there's all different ways people can get involved. The cost and the funding that we receive from the Community Foundation of Middlesex County goes towards the insurance, the background checks, and the technology of our website, because again, we're all volunteers at this point in time. So that funding goes specifically towards those enrollments, which means each person costs the organization about $100 a year. And that means if somebody came from New York, one background check is $95. So $100 a year with endless access to the website, which means endless access to volunteers, is really a very lean model, we think, to be able to help support people. This is one example of a volunteer and community member that are working together on a weekly basis to help support this 85-year-old woman with many health conditions, living alone and just trying to stay home and hold on to her independence as long as she can. And so she's very grateful for the support she's been given by her volunteer. So just some of our successes over the last couple of years. Again, we've grown to, actually, it's 125 towns in Connecticut. And we've received a lot of different grants and worked on a lot of projects with pro bono support. And that's where this team, many that are on the call today, our Charity Works employees, our pro bono professionals, we wouldn't be here without all of them. So we're grateful for everybody's time and commitment to helping us grow the organization. Because this solution to the problem of the aging population, growing community support, we think is a great opportunity for any town to get involved. There's many benefits of intergenerational connections. We know most towns are putting a lot of their services online. And so then community members that don't have technology, they're not on the same playing field. So we're really trying to work on allowing people to learn more about technology and teach them more about technology if they do have it at home. We have many different town departments that are now partners and enrolling people. So it's been great to watch our partner profiles grow as well. And like I said, we've received many different community foundations, but we are very grateful for the Community Foundation of Middlesex County that's allowed us to be here today. And in the next couple of months, we're going to be relaunching some features on our website, which is going to continue to grow our technology, which is so important as we are really a startup technology company as a nonprofit. So we're kind of in an interesting space of growth. This is Susan and Pam. They get together every week and work together. And it's just been amazing to watch the friendships that have grown outside of, just having a volunteer. It's really a great support system for people that look forward to having someone come to the house every week. And since we were granted this funding, we have already enrolled 20 participants since January. So that means that we've already met our enrollments for this grant. So we are really excited to say that we were successful in enrolling participants in Westbrook, Cromwell, Durham, East Haddam, Portland, Middletown, Middlefield, and Old Saybrook. And that being said, that's where we're going to continue to look for, like Sal was saying, funding opportunities, whether it's a business in Middletown that wants to give us basically seed money, the funding to help continue to enroll people, because there's a big cost to the organization for us to do this. And so we're looking for sponsors. That could be a business, that could be any municipality wanting to put us into some type of program to help invest so that we can then pay it forward and keep the website free for all participants that are wanting to sign up. So again, MD Birmingham, who's on the call today, and our vision is to really help support people of all different disabilities, aging, and those in especially all races and ethnicities, to make sure that everyone has access to resources in any town in Connecticut. So I thank you all for being here today. And our website, I'm not sure if everybody has seen it, yourcommunitycares.org. This is where you can go to sign up, sign in, sign up. A lot of people say, oh, I can't find the sign in and sign up button. But they're big pink buttons. Let's see, I can't do anything. Let's see. I was already signed in. So sign in and sign up. It's going to look different if you are on a tablet or a cell phone. Every device is a little bit different, but this is where you go to sign in and sign up directly on the website. And depending on how much time we have at the end, we can kind of review how to become a partner. But that's one big thing that people are interested in finding out about. And we can kind of go over that after our guest speakers and make sure we have time for everything today. Because we've really tried to make this as efficient and easy as possible. And I think you will see that once you've tried out the website. So at this time, I think I would open up to any questions anybody has. And
I have a question.
Yeah.
So I think it's a great program. One thing that I always am concerned about is someone trying to get into a residence and maybe take advantage of someone that truly needs your services. You talked about a background check, and you talk about there being a fee of $95 and needing the social security number to do the background check. What exactly are they checking on this background check?
So it's 7 years of state and federal. So $95 is just for New York. It's just an example that every state is different. So in Connecticut, it's $36, but many people are moving from other states. So we also do want to make sure that that 7 years of state and federal. That's people say, oh, are you asking my neighbors? No, it's just the court records.
So they're just searching court records. That's all they're searching.
For state and federal. So that was across the country, if they had anything on their record anywhere in the country.
But they're not fingerprinting them. They're just using their name and date of birth.
No, we don't have
Thank
it. We're 100% volunteer at this point, hopefully as we're growing, but we can't be fingerprinting at this time.
I understand. No, just want a clarification. Thank you very much.
Yep.
Dennis, you bring up a good point, and with with your background, we should pay attention to that. So I can see where that's leading, and I think as the organization grows, the vetting of volunteers in a manner that you may be wanting to suggest, maybe like an NCIC type background check, a little more extensive, and fingerprinting. A little more extensive than a state and federal court record, would be something that should be considered. But with that, there's an expense to it. But yes. Dennis, the overall intent and the spirit of your concern is absolutely warranted, because one can never be too sure as to who we're letting into people's homes.
I'm just very glad to hear that, Michelle, that they're doing a background check at all. I think that's a great thing. And I think it's a great program.
Yeah, I was just going to say really quickly that, maybe later on, that's something we definitely do. But for now, like Michelle said, social security number, obviously, and a picture as well. If you're an individual, but if you're within a partner organization, then obviously the organization accounts for you as well. So a lot of checks and balances within our system, even within reporting factor, from the community member and the volunteer, writing about how the community deed went and so forth. So that way it allows for the checks and balances to make sure everything went accordingly.
Yeah, so after the volunteer, the good deed that we call it, happens, then the community member reports, gives a testimonial, kind of like an Uber app, that you'll give the testimonial rating of the volunteer, and then the same thing happens, that the volunteer will give a testimonial rating. So if that person needed a ramp or they had no food in the fridge, that's an opportunity for the volunteer to report any findings and any concerns that they have. And then the same thing, the community member would report anything. And that's what we're monitoring all on the backside of this website. So we're monitoring that all the time.
And I just want to clarify, something regarding our platform. So there's two ways. There's the organic way where individuals sign up, as a volunteer or as a community member, the person requesting the help, or it can be through the community assistance team. And that's where we collaborate with, let's say, the human services department in the town, because they know their community members best, the ones that would need help. And they can manage accounts for several of them, whether it's 10 or so forth. And then the volunteer side, we usually connect with the police department, because they tend to have auxiliary volunteers. They may have some high school youth officer program. And then, so you have the volunteer side being complementary to the community member side. And that's a more structural approach that we're doing. And so far, Clinton's been the only town that we've successfully completed that in, but we're still looking to roll that out into other towns as well.
Thank you. In the interest of time, we're going to move on. I see a couple of hands raised, no specific order here, just how I see them on the screen. Kimberly McGrath, you have a question? If you can unmute yourself, please.
Hi, good afternoon. I actually have a couple of questions, if you don't mind. When I was looking at the profile of people who would be requesting volunteers, does that include people who are neurodiverse or have a mental health diagnosis?
Right now, we're focusing on two buckets of folks, people with physical disabilities over the age of 18, temporary or permanent, or over the age of 70. So as we're growing, we know that the needs are so vast right now, but these are the two, like we said, we've already enrolled the 20 people that we had planned on with this grant. So unfortunately, this grant is already capped. So we know that there's so many needs out there, but these are the two buckets that we have right now.
Okay, thank you. Then I have another question. I guess I have three. Another question related to the match itself. So if I understood correctly, when you were talking about your website, the person who is seeking assistance is registered, and they indicate the profile of their needs. And then your group of volunteers can search that website and look for matches, I'm assuming either based on need or time of day or week. So is there, built into that system, it looked like from your testimonials, that there's opportunities for people to establish relationships. So is it one person, one volunteer per that person who's requesting assistance, or are there potentially multiple volunteers who would be providing different types of assistance to a single person or household?
Good question.
So, Michelle, you want to address this, or you want me to?
Sure. I just wanted to be clear. So everybody has a portal, basically. So when you are a volunteer, you're going to pick the category that you're interested in. So if you're only interested in transportation, you're only going to get notifications based on that category that you choose upon enrollment. And you can always edit it for the future. But the volunteer picks which opportunities they're interested in based on the community member putting out the request. So the community member puts the request for that community deed. They can do that on a weekly basis, but it will go to it will go to the volunteer that chooses it. So it's almost like a first come, first choose, but it can be specific to a volunteer if the person requests somebody. So if Kimberly, if you requested Tina every time, you would put on the line, request Tina. And so everybody else would know that you're not going to accept that deed unless your name is Tina.
Okay, thank you. I appreciate it. One last question. Since you're offering services across so many different communities, and bravo, I just want to compliment you and everyone involved in your organization with everything that you've been able to do so far, and look forward to hearing many more updates. My question is, by community, are you able to sort your data by community so that you know, for example, how many people are requesting assistance in Old Saybrook and how many volunteers you have registered for that community.
Yes, we've
Yes.
been thankful to our pro bono professionals that have integrated Salesforce, so that all of our data can be correlated
Itemized.
per town, per grant, per participant, per deed. Everything can be broken down. So we can have a nice report for there very soon.
Okay, thank you very much. I appreciate your time and attention, and it's been wonderful to hear about the work that you're doing.
Thanks, and feel free to reach out to us separately. We can have another call with anybody who has, other questions, or we can continue the conversation.
Thank you.
And-
Really great questions. Next up is Anne Marie Perrone. You had your hand up for a while.
Hi, everybody. Just two comments. One, my mom is a community member and has used your services. Thank you so much. Made a difference in her life. And my question is more along the volunteers. Is there a way to know, because I'm going to try and get this going in my community, is there a way to know what the demographic is of the volunteers? Is it mostly people who have retired? Is it mostly young kids? Is it, do you have if you could point me in the right direction so I can start reaching out to those people in our community?
I would say middle-aged people are our primary volunteers.
Wow.
It can be, because of the pandemic, most high school students weren't doing any volunteer work. We're certainly open to having volunteers from high schools. We do have some, but we know that the pandemic sort of delayed that a little bit more than we had hoped. So it's really civic organizations. It could be, all different reasons that people are interested. But yes, Stafford is definitely an area where we are looking for volunteers. So I am really happy to hear that, Anne Marie. Appreciate you being here today.
Absolutely. Thank you so much.
Thank you. And next question is coming from Cynthia Lignar. Cynthia, if you can unmute yourself, please.
Yep, can you hear me okay?
Yes, we could.
All right, great. Just a quick question, have you been communicating with hospital discharge planners or rehab discharge planners and care agency, management staff and intake departments to let them know about your programs and services? Because I used to work in home care for many years, and this type of service is most helpful once patients especially are discharged from skilled services. So along the whole continuum, it would be great for them to be aware of your services as you go forward.
Yes, absolutely. My phone is
Thank
ringing
you.
all day long from, whether it's United Healthcare or Aetna or Connecticut. I mean, they're all looking for resources, whether it's an insurance company or hospitals. We know that so many people are looking for additional resources like us. But again, it comes down to funding. We're really focusing on the areas that we have funding in. I have been turning many, many people away because we need to make sure that we're responsible and have that funding model in place as we're growing. But yes, definitely reaching out to all the healthcare systems across Connecticut.
Great, thank you.
Yeah, and I know we might have a couple more questions, but I would like to make sure that we're getting our guest speakers. Sal, if that's okay.
Yeah, absolutely. I think we should move right into that. At this point right now, I don't see any other hands raised.
Okay.
So why don't we move into our first guest speaker while we still have a few minutes left here for the day.
Great. Vince is here. Chief DeMayo is here from the Clinton Police Department.
Hi, good afternoon, everybody. Thank you for having me here. I'm sorry, I'm on a really tight timeline. I'm doing a CALIA assessment for the Mount Pleasant Police Department down in South Carolina virtually. So I've got about 5 minutes, and I just wanted to talk to you a little bit about how we've implemented Your Community Cares and our platform here in Clinton. We've had this in the works probably for about 2 years before we actually, because unfortunately the pandemic struck right about the time we wanted to get out there. So there were a number of restrictions, and obviously the people that we were trying to provide services to were at the most at risk. So it really kind of slowed the implementation of the project here. But what we do as the Clinton Community Assistance Team, or CCAT as we call them, we utilize the Your Community Cares platform to connect our volunteer base and our people with service needs. And we, as the police department, provide training and support for our volunteers. So it's kind of a two-way street in that, number one, the people that are receiving services through Your Community Cares and the CCAT know that they're connected to the police department. We do a little extra vetting. We do a little extra training. We do some extra support. So I think there's a level of comfort there that's provided to certain users of the services. And secondly, it allows us the ability through Your Community Cares to really manage a group of individuals that we wanted to provide services to that we were unable to do because we just didn't have the manpower and resources to be able to gauge all the needs and then put our volunteers with that. We had a great group of volunteer people, majority of them which came through our Citizens Police Academy that wanted to help. So there was a ready pool of volunteers there. It's just we didn't have the administrative ability to get all those services connected because we're busy with all the police work stuff that we have to do. We didn't have that ability. So when Your Community Cares came along, it was a perfect marriage for us to allow us to deliver those additional services to the community, which we felt was being underserved. But there's also a very a cost piece which saves the town a lot of money. Listen, if you don't have these services available, officers are often tasked with going to do welfare checks. We have increased calls for services that normally could be addressed by the simple kind acts that we're doing through the Your Community Cares platform and the CCAT team. Simple little things now do not require sworn personnel to go from the fire department, from the police department. It allows people to age in place. And it also alleviates a lot of demand for public service, which would otherwise have to go there and take them off of additional tasks. So there is a cost savings as well to the municipality when you implement this way. And I think that's often overlooked. We all look about, doing the good things and being a helping neighbor, but there's also a cost savings to the municipality. And it's very good for an operational model to help us expand our service platform greatly as a public safety agency and reap those rewards without having to have extra officers assigned to us, which increases the budget, extra facilities and all the other things that go along with that. So I think the special a lot is not just the people receiving the services.
Great.
Chief, thank you. Thank you for taking time out of your busy schedule today and being with us. And as with Dennis, thank you for your service and keeping us safe, especially as we enter the warmer weather season, with hopefully a pandemic looking back at it, behind us, hopefully, so to speak, and activities start to increase along the shoreline. So thank you for your work and the time you spent. Michelle.
Thanks, Vince. And he is going to be on the Valley Shore Community Television, has been great to us, and we'll be sharing a lot of our stories on the Valley Community Television. So stay tuned for that. And
oops, sorry. If anybody wants information on how we started up, please feel free to reach out to me via email. It's vdemayo, like it says in my little box there, at clintonct.org, and be happy to answer any questions. And I'm sorry, but I got to be in South Carolina virtually now, so I'm going to have to check out. So thank you very much.
thanks.
Thanks, Chief.
All right, and our next guest speaker is Lynn Tracy from Portland Senior Center, sorry.
That's across the way, across the river. Hi, everybody. Well, first I wanted to thank you for having us here and also for involving us in the Middlesex County funding that was granted through and by via the Community Foundation, Middlesex County. Hi there, nice to see you. Really, I'm excited about this. Michelle and I spoke a while ago and at length about what it takes to run this program via Your Community Cares and the money and what's involved with fees. Chief DeMeo just gives me so much hope. So I will be emailing him directly to find out more about the, municipality monies that can be saved by doing it in his fashion. I think it's fantastic. I believe in what Your Community Cares does, and our seniors are calling every day now since I have communicated that we are working with Your Community Cares. We've had a Zoom recently with Michelle, and a couple of our seniors chimed in. Some are interested in becoming volunteers, and some are interested in seeking services. What we do here is we have a very small staff. It's myself and a full-time assistant, and most of our day is consumed by rides, and we have such a huge need for rides. Essentially, I can't even tell you what's happened over last month. I mean, the phone is ringing off the hook, and we have 3 drivers. We don't always have 3 vehicles. This is great in that some of our folks could go via Your Community Cares and, sign up for assistance to get rides to some places, shopping, or maybe a medical ride. That's probably going to be the biggest need. But as we were on this call, I just received a call from a lady who needs help pumping her gas. I mean, they need help, obviously, with yard work. Some of them are lonely, and they would just like to have a companion come through. A lot of calls coming through since we've communicated that we are now working with Your Community Cares. So Michelle and I talked about, she brought up an ice cream social kind of a thing, and we're going to do that in June here through a summer party that the senior center is throwing. Youth services is also going to be a part of it. This is a great opportunity to recruit some younger volunteers as well, because our seniors also can use some assistance with tech. They've really been excited about technology since the pandemic, and now the need to learn it has heightened because of this new, 4G, 5G. I don't know what they're doing now with the phones, but the flip phones are gone. Now the seniors have these iPhones, and they don't know, what to do with them. So younger people could volunteer to help with their tech needs, which helps them, through education, through AARP or telemed, or just staying in touch with their family and friends and the senior center if they're not well, or if it's inclement weather, and if they're lonely. So this is amazing. I'm so excited and pumped about this. And I'm hopeful that we can find ways to get funding to take advantage of more of these services that Your Community Cares offers. I think it's an amazing community connection. So I wanted to thank you for involving Portland. As soon as I heard about you, I reached out, and I'm really excited.
Thanks, Lynn. Yep, you've been a great asset as you're, educating your seniors, and that's really what it comes down to, is letting people know that we're here, and many people didn't even know that we existed. So again, we thank there and the Community Foundation of Middlesex County to make this happen. And we know we're already at 1:03, and I want to be cautious of everybody's time. Our website has also all of our social media, which is always providing more information. So please subscribe or like any of our social media to get more information about the organization. And feel free to reach out to me individually if you have questions or would like to go through the website individually. And want to make sure everybody's information is in the chat so I can get back in touch with everybody that was here today. So thank you for putting that information as well. Sal, was there anything else you were?
No, just a couple more things I just want to mention. There is a YouTube channel, and the link to that channel has been placed in the chat that I think you'll find very informative. And also, if you go online, there was a great article on March 5th in the Middletown Press when they initially received the foundation's grant. That really goes into some good detail as to the great work that Your Community Cares is doing. So I'd encourage you all to take a look at this article. What sticks out in my head is that, each day we're reminded of the challenges that folks face with common tasks like raking leaves, dusting, and shopping for groceries. this is what this is the impact that we're making on folks. And I'd encourage you all to pay attention to this, to encourage stewardship of this organization, both through helping with volunteers, helping with funding, and promoting it within our communities. And also key to the success here is that it's not just for our seniors 70 and older at this point. It's also for anybody who's temporarily or permanently disabled over the age of 18. So with that, I want to thank everybody for taking time out of their schedule today. And Michelle, I'll turn it over to you for any closing remarks, and I look forward to working with everybody in the future.
Thanks, Al, thank you for helping with this meeting today. And we will be successful in Middlesex County. We know that the needs exist. We know that there's many people that want to provide those acts of kindness, and they can do that through our website, yourcommunitycares.org. They can do that all year. So we know that they can make a positive impact in communities and make communities stronger by coming together. So we're really excited to watch that continue to grow throughout the year. Now that people are enrolled, now it's the time to actually work together. So we're excited to get involved. So thank you all for coming today. And have a great day.
Thank you.
Thank you.
Have a great day, everybody. Thank you.
Bye-bye. Thanks.
You.
Thanks. Bye-bye.
Bye now.
Bye-bye.